What's up, everyone? Welcome back to the Move Better channel. I'm your host, Dr. Joe, and this is the Professor John Penisarada. Today, we're going to talk about neck pain and what we need to do in order to fix it. Let's go.
So, in addressing the neck issue, whether you're trying to strengthen it or alleviate some of the pain, sometimes we can go to the gym and use the iron neck equipment. Costs a couple $100, but in practicality sense, we could use bands, and those cost maybe like $20 or less, right?
Yeah.
And you can order that online and
Just being more cost effective.
Exactly.
For now, at least, because you're not going to go out and buy
an iron neck equipment.
An iron neck equipment all of a sudden when you have a stiff neck. So let's figure. I got to buy an iron neck in order to fix myself right now. So
just get some TheraBands, and this is what we'll do.
Yeah. Although I do love the iron neck, it's an amazing, amazing machine. But anyways.
All right.
So with neck pain, there are exercises out there that may be able to work. You might be able to do some stretches. You may be able to do some massage techniques that may be able to relieve some of the pain. But what if they don't? And you need some activation techniques in order to decrease that pain. Well, you have certain machines out there. Now they have the iron neck is what they're using, right? And it's basically a halo system that covers your head. And it's a strap, it's a band. I love that machine. I love that I love those workouts for all of our patients. But what if you don't have access to all of that? And let's say you only have access to some bands. Well, let's go ahead and give you some exercises that we can do in order to increase some strength in that neck and slowly get you to have that iron neck. Okay, so John, first thing you're gonna do, we're gonna place this around your head. You're gonna keep your eyes closed. Please, everyone, keep your eyes closed when we do these exercises. So, but not you. Right now, just watch. So, John's simply going to close his eyes. He's going to pull that band, and simply put, his head is just going to fight the band, and he's just going to push his head straight back against it. Now, if he has bilateral neck pain, let's go ahead and relax, John. You're going to turn and face this way. If he has bilateral neck pain, he's going to just push his head straight back against it, giving himself that double chin. Try not to look up, try not to look down. This is going to help tension the stabilizer muscles of the neck. Now, as he's keeping his eyes closed, one of the things that I want him to do is just move his eyes left and right. Those work on the tiny muscles next to that are inside the spine that will help to relieve some of that pressure and that tension. Next, what he's going to do, if he has it more on his left side, he's going to pull his hand to the right. And as he's pulling his hand to the right, he's going to put a little bit more tension onto that left side of the neck. If it's on the right side, he's going to pull his hand onto the left side, and he's going to put more tension along the right side of the neck. And this is just an isometric contraction of the muscles that allow his head to stabilize, his neck to stabilize. Now, when he's doing it under those positions as well, he can hold his hand there and again, move his eyes left and right with his eyes closed. And that will allow the stabilizer muscles of the neck to start to work. Now, step two, one of the things that we need to do is we need to create movement. We want to get a little bit more dynamic with the muscles rather than just holding tension. Now, if you have a stiff neck and that isometric contraction helped a lot, great, you relieved your pain. Now we want to try to retrain your movement patterns along with it. So John, go ahead and grab that band again. He's going to pull. Now he's going to keep that band against his head. Now, keeping his eyes closed, all he's going to do is with his thumb in place, he's going to slightly rotate his neck. Hold it. Hold that position until the pain goes down. He's going to rotate the opposite way. Hold it at that position till the pain goes down. And then he's going to rotate a little bit further to the opposite way. A little bit more, a little bit more, a little bit more each time. Hold his position there, move his eyes left and right, and then he's going to go back to the opposite side. Hold that position, eyes left and right, and then he's going to go back into that position again. And then he's going to go ahead and rotate your hand, rotate your head, move your eyes left and right, keeping your eyes closed, and then he's going to rotate his head the opposite way, move your eyes left and right, and then go ahead and relax. These are just some isometric contractions that you can work with in order to help fix the strength and work on that iron neck. Now, he can also do it with a band like this. He's going to just take this, now he's going to use both hands, and he's just going to pull those hands straight forward as he pushes his neck backwards, as he's giving himself that double chin. He's not trying to look up, he's not trying to look down, he's just pushing straight back against that band. And as he's pushing straight back, again, moving his eyes left and right. So it depends on what kind of band you have. You can use this band, or you could use a TheraBand that works just as well. If you have a functional band, you can use those too. Anything that's going to allow you to put a little bit of stress along that back of the neck. And then the last exercise, we're going to work a little bit on stretching. Now notice where he has the band now, turn this way. The band is at the back of his neck here, and he's just going to pull those bands straight forward as he's keeping his head straight back. Now, if you can do this in front of a mirror, that would probably be the best way to do it. So that way you'll notice that you're not lifting your chin up, or you're not looking down too far, and you're just pushing straight back against the band. And so from here, he could do it this way, or if he would like to, he can even drop his hands down a little bit. And as he pushes straight back, now we're working on stretching the curvature of his neck. All right, everyone, try those exercises for the neck. See if it alleviated some of your stiff neck or your neck pains that you often deal with. Sometimes it may even help out with some of those headaches. John was just describing how he was feeling some of the muscle tension at the top of his head, and that's okay. We're trying to alleviate some of that pain, again, by activating the tissues, activating those muscles, and get them to work. Let us know how we did, and let us know how you did. Like, subscribe, share, comment below. Let us know how this pain was alleviated or not. We want to help you. We want to get you guys better. Thanks, everyone. See you on the next video.